How do beneficence and non-maleficence apply to dual medical roles? Imagine a doctor who is both caring for a patient and also involved in research or teaching. How do they make sure they do the right thing in both roles? That's where beneficence and non-maleficence come into play. These are two main principles guiding medical ethics. Beneficence means acting to help the patient and promote their health. Non-maleficence means avoiding harm and preventing unnecessary suffering. When a healthcare professional has more than one role, things can get a little tricky. For example, if a doctor is treating a patient and also conducting research, they must ensure the research procedures do not put the patient at risk. The patient's safety and well-being should always come first. In dual roles, conflicts of interest can happen. Say a doctor supervises medical students while caring for a patient. The doctor must make sure teaching activities do not interfere with quality care. If an inexperienced student is involved, the doctor must decide if it's safe for the patient and whether the student is ready to perform certain procedures. The doctor should always prioritize the patient's health over educational opportunities. This aligns with beneficence, which pushes healthcare workers to act in the patient's best interest. At the same time, non-maleficence reminds them to prevent harm, like avoiding procedures that could cause injury or pain. Clear communication is key. The doctor should explain to the patient what is happening, especially if research or teaching is involved. Getting informed consent is essential so the patient understands any risks and benefits. Maintaining professional boundaries also matters. For example, a doctor must be cautious not to let their multiple roles compromise the quality of care. They should regularly assess whether their actions are benefiting the patient and avoiding harm. In practice, this means balancing responsibilities carefully. If a doctor is involved in research, they should ensure the study has been approved ethically and that the patient is not exposed to unnecessary risks. If they are supervising trainees, they need to make sure the trainees are competent and that patient safety is not compromised. Ultimately, beneficence and non-maleficence serve as guiding lights. They help healthcare professionals navigate complex situations, ensuring that even with multiple roles, the patient's well-being remains the top priority. These principles reminded us that doing good and avoiding harm are always at the heart of ethical medical practice.